Good afternoon, everybody. Thank you for joining us again today. I want to, as usual, provide you with an update on Scotland's response to the COVID-19 epidemic. First of all, I can confirm that as at 9 o'clock this morning, there have been 3,001 positive cases confirmed, which is an increase of 399 from the figures I confirmed yesterday. A total of 176 people last night were in intensive care with confirmed or suspected cases of COVID-19. That is an increase of 14 on yesterday. And I can also confirm that a total of 1,321 people, including the intensive care patients with confirmed or suspected COVID-19, were in hospitals across the country. And it is with sadness that I must report a further 46 deaths of patients who had tested positive for the virus. That takes the total number of deaths in Scotland now to 172. And as is always the case, I want to extend my condolences to all of those who have lost loved ones. We announce on a daily basis the numbers of deaths, but we should never ever forget that every single one of these statistics is a human being who leaves behind relatives and friends who grieve for them. I want also to thank again today everyone working in our health and care sector, but I'm also well aware that there are many other people who are also going the extra mile right now. And today I want to particularly acknowledge people working in our food and drink and essential retail sectors. This is not an easy time at all to work in agriculture or food manufacturing or distribution, or of course in stores and supermarkets that require to remain open. But what everybody in all of these different sectors do is absolutely essential for all of us, and I'm grateful to all of them and want to take the opportunity today to say a heartfelt thank you. I really want to cover three issues today before taking questions. First of all, I want to follow up on some of the points I made yesterday about testing in Scotland. I know that there has been a lot of attention last night and into today around the UK government's pledge to test 100,000 people a day by the end of April. Now, obviously, and this is simply a statement of fact, it's not for me to set out the basis of the UK government's target or indeed how it plans to get there. What I can do, and indeed what I have a responsibility to do, is set out what Scotland is doing, including the work we are doing with the UK government. Now, when you factor in the difference in size between Scotland and the UK, what we are doing here will take Scotland to the same sort of position that the UK seems to be aiming for. We are increasing NHS Scotland's current capacity of 1,900 tests a day to at least 3,500 tests a day by the end of this month at the latest. And that is broadly similar, although slightly more ambitious than the UK Pillar 1 target of 25,000 tests a day. This expansion of testing capacity means, amongst other things, that we will be able to test more key workers with every day that passes. However, in addition to increasing capacity within NHS Scotland, we are also working with the UK government and other partners to further increase testing capacity beyond that. Yesterday's announcement that a new testing facility is being established by Glasgow University in collaboration with industry partners and the NHS is a very good example of that. We in Scotland are currently working to establish exactly how many more tests we think the Glasgow University facility, together with other initiatives, will deliver. However, there is no doubt that they will allow us to increase our testing capacity in a way which is proportionate with the rest of the UK. Finally, we continue to think about how widespread testing, including perhaps antibody testing, will be used in helping us to move out of this period of lockdown. Specifically in relation to an antibody test, as I said yesterday, as others have also said, that kind of test doesn't currently exist in a reliable form. We certainly hope that it will do soon, but the fact is that might still be some time away. The Scottish Government has established a testing oversight group involving the Chief Scientist for Health, Professor David Crossman, and it has been tasked with overseeing the following strands. Firstly, the increase of NHS lab capacity and also the Scottish delivery of the UK-wide programme to deliver non-NHS testing. Secondly, the development of antibody testing so that as soon as tests are available, we are in a position to deploy them here in Scotland. Thirdly, surveillance, epidemiology and prioritisation. That strand will also look ahead to the role of testing in our eventual strategy to exit the lockdown measures. Next, logistics and access to testing, and lastly, data management. The second issue I want to cover briefly today concerns shielding, which you will recall are the measures we are putting in place to protect people who are at the highest risk if they contract COVID-19 because of their existing health conditions. We had previously estimated, and it was a rough estimate, that up to 200,000 people would be in this group. We've been doing further work to remove duplication from records and ensure accuracy, and we can now say with more confidence that there are approximately 120,000 people across Scotland in one or more of these categories. And if you are uncertain about whether or not you should be one of them, full details are available on the NHS Inform website. The Chief Medical Officer has now sent more than 110,000 letters to people in these groups, and the remainder of these will arrive shortly. These letters, and those watching who have received one will know about this, they give information on how people can shield themselves from infection, and also, crucially, because we're asking these people to isolate for a 12-week period, so these letters provide detail on what support is available to them. This support includes access to home deliveries of essential food items and toiletries through a text message service. I can say that more than 8,000 people have already signed up for this service and have been texted with the option of receiving deliveries. Those deliveries started this morning. I want to stress that you don't need to have a mobile phone to register. Anyone in the highest risk group can sign up if they need it. Details of how to do that are in the letters that people will have received. In addition, information is available on the NHS Inform website and through the main phone switchboard of your local council, and we'll be writing again soon with local contact details. And I want today to encourage everyone who is in this high risk group who has received or will receive one of these letters to register. You might not feel you need help right now. You may have family or friends who are providing the support you need. But registering now will help us to keep in touch with you if you need help later on. We're also working with local health boards to ensure the delivery of specialist medicines such as chemotherapy drugs to people in this group, and we're working with supermarkets to prioritise delivery slots. Fundamentally, we know that some people, due to pre-existing conditions, are at particularly high risk should they contract this virus. So we are determined to shield them and also to give them the support they need to ensure that they can protect themselves. The final issue I want to mention is, of course, as everybody knows, we're now 1 week away from Easter, and this weekend, of course, would have marked the start of the Easter school holidays. And there's no doubt that we are about to head into what, yes, would have been the spring holiday season, but one of the most unusual holiday periods that we have faced. And as everybody knows, although schools have been closed, school and childcare facility provision is still available in all local authorities for people who need it, for example, children of health and care service staff. So I can confirm today that all local authorities will keep learning and childcare centres open in their area during the holiday period. The arrangements made during the holidays might be different from those made during term time. The number of centres that are open and the types of support they provide will vary in different council areas according to local need. But by making learning and childcare available in every local authority area over the holiday period, we can make sure children are safe and well looked after while their parents are able to do critical jobs. And I'm very grateful to all local authorities for working with us on this. There is, of course, a more general point about the Easter holidays. As I said a moment ago, this will be a holiday period unlike any we have known in our lifetimes. I know that many people will be thinking about the plans they had made before this epidemic struck to get away and to visit friends and relatives. And of course, it's not possible now to go on holiday around Scotland or to visit friends. Everyone will be staying home except for essential purposes such as exercise or buying essential supplies. And once again, I know how hard this is. But I also want to stress again today that these restrictions are absolutely essential. You know, we've heard discussion today in the media to the effect that this virus may peak in around 1 week's time. And I want to address that point directly. Firstly, there is, of course, still a lot of uncertainty around when we can expect the virus to peak. And as we gather more data, I hope that we will be able to offer more certainty about that in the period ahead. But I want to be very clear, because I've always said I will be straight with people in these difficult times. I want to be very clear that nothing I have seen gives me any basis whatsoever for predicting that the virus will peak as early as a week's time here in Scotland. So I don't want people to have a false expectation based on what they might be hearing in the media today. And that message is important because I have to ask people, we all have to ask all of you to continue to stick with these measures, no matter how difficult they are. Many of us took part last night in the applause for NHS and care workers that was heard to the accompaniment of the bagpipes right across the country. But it continues to be the case that the best and the most important way in which all of us can help our health and care services is by staying at home as much as possible and by keeping our distance from each other. So I want to end by thanking all of you for doing the right thing and staying at home over this holiday period, because this is how we will slow the spread of this virus. It is how we will protect our NHS from being overwhelmed, and it is how we will save lives. So thank you to each and every one of you. I'll now hand over to the Chief Medical Officer, who will say a few more words before I open to questions from the media.
Thank you, First Minister. I would just like to pick up the points that the First Minister has made about the peak and the potential timing of the peak of the virus. Many of us are familiar with this curve that we've been discussing, trying to flatten the curve by introducing these suppression measures to stop the number of people becoming infected, overwhelming our NHS, and to avoid people becoming very sick and dying. That curve has been based on mathematical modelling, computerised versions of what might happen in the real world. We have moved now to have real cases of people who are infected, going into hospital, going to ICU, and sadly dying. So we are now transitioning from what is a mathematical and theoretical model into real data using real people in Scotland to inform our knowledge of the virus spreading. I have been watching these models and now the new data as the numbers increase every day, and I have not been able to find that the peak will be as soon as we are hearing in reports in the media today. We need more information. We have always said that it would take 2 to 3 weeks to be able to have some more certainty, but even then there will be some lack of knowledge because of numbers still increasing. So I would urge people to keep going with these stringent measures. Now is not the time to think that perhaps it will all be over soon. We have always said that many months will be needed before we can get on top of this virus and be sure that we're not going to have a worse scenario later with more of the virus reappearing if people are becoming less stringent with their social distancing measures. I would also just like to make a second point today, and I think we will be returning to this. I've heard reports of people being concerned about coming forward to be seen by their GPs or coming forward into hospital services because they're worried about coronavirus. In particular, children are very unlikely to be severely affected by coronavirus. So that if parents are holding back from phoning their GP, from contacting NHS 24, or for bringing an ill child to hospital, it is very unlikely that that child will have coronavirus and be needing to stay at home. If you would have sought help in the past, please seek that medical healthcare help now too. All of our conditions that we would normally have at this time of year are still going to happen. People will have heart attacks, people will get appendicitis, people will have strokes, children will get meningitis. What we want is that the right healthcare is delivered at the right time, And in particular, if an emergency call is needed, please do not hesitate to make that. We will be giving more information to the public over the coming days, but we want to emphasise that not everything will be coronavirus, and that healthcare is a safe place to be seen and looked after if you're unwell.
Okay, thank you very much. I'm now going to go to journalists who are joining us online, and myself, Chief Medical Officer and the Health Secretary, will be happy to answer questions. So firstly, can I go to David Henderson from the BBC?
First Minister, thanks very much indeed. On the face of it, and from what you were saying today, the Scottish target for testing at 3,500 people per day is far less than it is in England, or than it will be in England, Wales and Ireland. Why is your target apparently so modest? And a question for the Chief Medical Officer: as the NHS builds capacity on ventilators, how many are now operational in Scottish hospitals, and how many will we have at the end of April as we approach the peak of the virus pandemic?
Okay, I'll take your first question, David, and I know it's a bit difficult because people are listening to this online, but actually if you listen to what I said, you would realise that our target on testing is not less ambitious than the rest of the UK, and I went through that in some detail, which I'm happy to do again. The 3,500 target that we have set for the end of this month at the latest is equivalent to the first pillar of the 5 pillars that Matt Hancock outlined yesterday. And that is the expansion within the NHS of existing PCR diagnostic testing. The UK's target, the equivalent target to our 3,500, is 25,000 by the end of April. So actually, proportionately, our target is a bit more ambitious than the UK's. Now, it is over and above that that we then get, the UK then say they will get to 100,000, and what I'm saying is through those same measures, Scotland will get to a position that is proportionately the same. So you add to our 3,500 to their 25,000, which is within the NHS, the testing that can be done through the kind of initiatives like the one that Glasgow University is part of, and we are working right now to get clarity and certainty of how many additional tests we will be able to do through those routes. And I'm going to wait until I have certainty before I give fixed numbers, but it is the case that those additional initiatives will allow us to get proportionately to a similar level to the ambition that the UK government set out. So it's very important to be clear, and I want to be crystal clear about this. It is not the right comparison to compare our 3,500 to the UK's 100,000. The comparison with 3,500 is 25,000, and we are both trying to get to a level that for the UK is 100,000 and for us would be the approximate 10% of that. So there is no difference in terms of the aims that we have set. So I hope I'm making that absolutely crystal clear. Now I'll pass on to the Health Secretary on ventilators and the other aspects of the question.
Thank you very much. So at the moment we have capacity in ventilator equipment of just around 500 ventilators across our NHS estate. And we have announced this week, of course, that we have repurposed some of the anaesthetic operating machines to bridge any gap between our current capacity and orders coming online. So we have a number of orders in. We are looking on a daily basis at the alignment between our capacity in intensive care and what we expect the demand on that to be. But again, as I always do when answering questions like this, the demand part of it is not fixed. All of us have the ability to influence the demand by complying with these measures. Every single person who is staying at home, as we are asking them to do today, is helping us reduce the eventual demand for intensive care and other hospital services. Can I go now to Peter McMahon at ITV Border?
First Minister, you said that everything you've seen and heard from the information you've got in tells you that there won't be a peak next week or over Easter. But can you tell us, from all the information that you have and the mathematical modelling, when you think the peak will be in Scotland? And is there any evidence of regional variations within Scotland? Obviously, we're particularly interested at ITV Border in the Dumfries and Galloway and the Scottish borders.
I'm going to hand over to the Chief Medical Officer, but in short, what I would say is no, I can't tell you that right now. That's the point that both I and the Chief Medical Officer have made. We're transitioning from computer models to modelling that is populated with real data. And I would hope that over the next couple of weeks, we will start to be able to give more certainty in our predictions about when a peak might happen. But I want to be clear today that for Scotland, and I can only speak for Scotland, nothing I have seen, absolutely nothing I have seen, would give me any basis whatsoever for saying that this virus will peak in a week's time. And I know there will be media messages across the whole of the UK today that people will be hearing. And if I have to continue to ask people to do the right thing, it's important that I am doing that on the basis of frankness about things. And I don't want people to hear something that, in my view, for Scotland is not the case, without being very clear that is not what I think the situation is. But I'll hand over to the Chief Medical Officer, who can maybe say a bit more about the processes that hopefully might give us more certainty in the weeks to come, but also the issue of regional variation, or not, as the case may be.
Thank you, Peter, for your question. We have those data building up day by day, but as you have seen, even in the last week, each day we are announcing more people infected with the virus than the day before, confirmed cases, more people being admitted to hospital and intensive care, and more deaths day on day, sadly, as we go through this epidemic. So at the moment, we will not be able to give a clear date of when the peak would be. What we would look for first is a slowing in the rate of those people becoming positive, and we are not seeing that yet. In fact, the proportion of people being tested who are positive is increasing day by day and has done so for the past 2 to 3 weeks. We will only, of course, know when the peak has been when the cases start to drop. So all of this is speculation, to some extent informed speculation on the modelling, but as I've said, it's the real data now that is key. And I'm afraid we will have more information in another week, but even then we may not be able to say for certain when that peak will be. Of course, the measures are working. We will see that those cases start to slow, and then we will have a more accurate idea. The borders or regional variation that you're asking about, we have still got the proportion of cases in each of our health boards at roughly the sort of numbers we would expect with the population. So we're not seeing any particularly strong regional or local variation across Scotland.
Okay, thank you. Peter, Stephen Brown from STV.
You've announced a further 46 deaths today in Scotland. Can I check if any of that is based on what happened yesterday in terms of delayed reporting in any of those deaths? And of the 172 deaths in Scotland, how many, if any, relate to any NHS workers?
On the latter part of the question, I cannot give you that information right now. We are looking, and I said this yesterday, we hope to be able to provide a much more detailed breakdown of these figures next week at some point, and we'll give more information in due course as to exactly what those breakdowns will be. We've been constrained in that up until now because, before I say this, I just remember every one of these statistics is a person, so I don't want to minimise it, but when we're dealing with low numbers, issues of patient confidentiality are clearly much more relevant. So as the numbers sadly rise, we can give more breakdown, and we're looking at exactly what can be provided. In terms of the first part of your question, obviously, as I set out in some detail yesterday, Health Protection Scotland have changed the basis for reporting previously, and this is also partly to do with numbers rising. So previously, health boards were notifying HPS of confirmed cases of people who had died. There was sometimes a bit of a lag there for family notification. HPS are now operating on the basis of the NRS death certification process, which hopefully reduces any time lag. So it's possible that in the numbers today, there may be a small number that, had we still been on the old system, might not have reported until tomorrow or the day after. But I think we should assume that the numbers we're seeing from now on are a reflection of the acceleration of the impact of the virus. Paul Smith from LBC.
Thank you very much, First Minister. Yourself and the Chief Medical Officer just mentioned that there's no evidence of a peak here in Scotland of the virus. Does this mean that lockdown in Scotland will be extended by a week or so? And also, I'm just wondering if you could give us an update on the development of the Louisa Jordan Hospital in Glasgow.
Okay, on the question of the peak, we have always said that these measures are likely to be in place for a long number of weeks. And I've not said that with any relish. I don't like standing here telling people that we'll all have to live our lives in this very restricted way for any longer than is necessary. But nobody will thank me or any of us in months to come if we prematurely lift these measures and then the virus takes a much deadlier toll than it would otherwise have done. So everything I'm asking people to do is, in our judgment, necessary to slow down the spread of the virus and reduce the peak. When we announced the lockdown measures almost now a couple of weeks ago, we said across the UK that we would review these around Easter, and that review process will be done. We are already looking at how we do that here in Scotland, and of course that will feed into a four-nation discussion. But I don't want, based on everything I know and see, and I'm sharing as much of that as I possibly can with the wider public, there is nothing that would allow me to stand here with any shred of confidence and say that we are going to be lifting these measures in a very short space of time. Now, if I turn out to be wrong about that, nobody will be more delighted than I am. But I've got to be honest with people that we are in this for the long haul if we are to have the impact that these measures are intended to have. And on Louisa Jordan, I think I'll hand over to the Health Secretary to say a word about the progress of our temporary hospital.
Thanks very much, First Minister. The NHS Louisa Jordan, the work has begun on that site. It's on track to be completed within those 2 weeks, ready for our use in 2 weeks' time if we need it. The Chief Executive, Joe Young, is on site, the Medical Director, a number of clinicians and construction workers. So it is going ahead as we planned it to be and will be ready for our use, should we need it, with those first 300 beds in 2 weeks' time.
Hamish Penman from Original 106.
Good afternoon, First Minister. Oil and gas bosses have been calling for coronavirus testing to be extended to key workers going offshore to minimise the chance for an outbreak at sea and a potential rig closure. Is this something the Scottish Government are exploring? And if so, is there a timescale for it?
Well, I'll come back to, I suppose, the core of what I said about testing. We are working rapidly to scale up testing capacity. Firstly, within the NHS, and that's my 3,500 at least by the end of the month at the latest, but also over and above that. So everybody is familiar with the announcement yesterday that Glasgow University has established a test centre, and that will enable us to go beyond that. So as we scale up our testing capacity, and that's happening on a day-by-day basis, then we will be able to test more people. But we have set very clear priorities that are based on evidence of what the most important areas are. So using testing to support the treatment of those who are seriously ill, key workers, starting with health and social care, and also testing for surveillance. At a later stage, testing will also be important in terms of coming out of these lockdown measures. Of course, as we scale up our capacity, we will be happy to have discussions with other sectors about whether or not they should be given greater priority, but that will be done within a clear framework of principles. And I mentioned earlier on the establishment of our testing oversight group, which will be experts basically making sure that we deliver all we're talking about on testing, but also some of these decisions can be given further consideration. Vivian Aitken from The Record. Vivian, are you there?
Sorry, technical hitch.
Okay.
You've adequately covered most of what I was going to ask. Just one thing about testing. Are we looking at other testing sites, other laboratories on a commercial partnership like the Glasgow University one?
Yes, so the Glasgow University one is part of a fairly well-developed now UK programme where I think there are going to be 3 labs, of which Glasgow is one across the UK. But yes, we are exploring other options and opportunities both in the academic sector and commercial partnerships. Do you want to say more about that? Okay, Libby Brooks from The Guardian.
Hello, First Minister. Can I just clarify those extra details that you're hoping to give on deaths from next week? Is that going to follow the template that England has been releasing since yesterday, i.e. on sort of date, age group and region? And also, can I just clarify on the daily deaths, is that hospital deaths only, or is it now including community deaths?
The Chief Medical Officer will come in if I get any of the detail of this wrong. The deaths are deaths with a confirmed laboratory diagnosis of COVID-19, regardless of setting. But I think the likelihood is most of them are hospital deaths. From next week, we will also, NRS will also publish deaths that are not just confirmed cases, but also presumed cases, again, regardless of setting. So where a doctor has put COVID-19 on a death certificate, it hasn't been confirmed through a test, but there is a presumption that COVID-19 has been a factor in the death. I'll hand over to the Chief Medical Officer on that point in a minute, because she can probably explain it better than I can. But on the point about information, I don't know exactly what the English template is delivering. We want to give as much information as is possible, and this may change as we go through as numbers rise. So we're looking right now at just how much information can be provided, and I said yesterday we'll provide more information on what that will entail as soon as possible. Do you want to cover anything on deaths?
The letter I sent was on the 23rd of March, which asked all medical practitioners who might be certifying a death that if they were strongly suspected that the person had symptoms of coronavirus, that they put presumed COVID-19 on that death certificate. So those cases will now be reported by NRS from next week. The question about the detailed breakdown, as you know, I have been very, very careful for absolutely justifiable reasons that we do not breach patient confidentiality. So I would expect that we will have a breakdown, we would have gender, we will also be able to have some more detail about where the deaths occurred. But if at any time there are very low numbers, so I could imagine in some of our smaller health boards, if there was any suspicion that people could be identified because we were breaking down something that would be more detailed, we will still not give those numbers because of confidentiality reasons. But we are looking at a range of detail that would be able to be published without breaching any patient confidentiality and obviously respecting the families of those who have sadly died.
Okay, thank you. Tom Martin from the Express.
Good afternoon, First Minister. Following the testing announcements by Matt Hancock, he was suggesting longer term we could move to some kind of system, or certainly England could move to some kind of system of immunity bracelet certification in the longer term that could help, show that people have recovered and help ease the lockdown restrictions. I just wondered if you thought that was something that could be helpful in the longer term once you've got antibody testing, and whether it was something that could be explored.
Well, I'll hand over to the CMO to give the scientific answer to this. I'll give the more political answer. I think if we can get to a stage where we have an antibody test that is reliable and we know enough about what level of immunity this virus actually does confer, and whether these tests then allow somebody to say, I've had it, so I won't get it again ever or for a period of time, then yes, that kind of approach could help us in the future. So I certainly don't rule that out, but there are some unanswered questions I think that we have to get answers to along the way before we would be able to judge whether that was a reliable kind of system or whether it would actually just give people a lot of false assurance. So these are very much things that are work in progress.
As this is a new virus, we don't know how long immunity would last for. We look at coronaviruses in general, many of them cause the common cold, and we know that we don't all get lifelong immunity to the common cold. So at the moment, the unknowns, as the First Minister have described, need to be worked through. It would not be the right thing to give somebody a bracelet that said that they were immune if, in fact, that immunity had some time limitation on it. I think we need to get these tests validated. The early progress is to get those as accurate as possible. We want tests to be both sensitive and specific so that we're giving people the right answer as to whether they have antibodies or not. But we also need to look at what the immunity pattern is amongst people before we could ever give any kind of certainty that having had coronavirus meant that you weren't going to get it a second time.
Okay, thank you. Tom Peterkin from the P&J.
Good afternoon, First Minister. On the subject of foreign nations' procurement of ventilators and tests, Mark Drakeford, the Welsh First Minister, said, "We don't want to be competing with one another for scarce resources. Working together with colleagues in Scotland, Northern Ireland and England gives us resilience in the system." Now, given that there was a threat of a bidding war between NHS and NHS Wales and NHS England, and the fact that Scotland's still doing its own thing on procurement, I mean, can you guarantee that Scotland won't get into a bidding war?
I think it is incumbent on all of us across the UK not to get into bidding wars or any other kind of issues of tension. I mean, at times we'll have slightly different views on how to approach this. There's nothing wrong with that. We work through them, and if we take slightly different approaches, we explain why that is the case. But, you know, we're all in the same position here, and we all have to work together and collaborate to try to give ourselves the best chance of dealing with this. Just to be clear again what the position is with procurement, and you know, what I'm about to say applies to testing, tests and testing capacity, it applies to ventilators, and I think applies to PPE as well. We do our own procurement, so a number of the orders we've got in for ventilators are orders we've placed with established manufacturers, but over and above that, we are taking part in four-nation procurement initiatives that will supplement that. So these are sensible ways of proceeding. There's a lot of ongoing discussion between the four governments, and you know, I keep saying this, and I'll say it again because I think it bears repetition. We're not in normal times here. This is not a standard situation where the kind of disagreements and tensions between the four governments would perhaps be more to the fore. We all face a common challenge here. We're all dealing with the same issues and trying to address it. So the emphasis has to be very much on collaboration and working our way through these things together. And that's the approach the Scottish Government has taken. I think it's the approach the other governments are taking. And I think we have to absolutely make sure that continues. Michael Blackley from the Daily Mail.
Hello, good afternoon. When the element of the emergency legislation relating to jury trials was withdrawn this week, it was confirmed that there would be further legislation in the coming weeks. What is your focus right now? Is it an assumption that there will be a lengthy suspension of jury trials and therefore measures to tackle the backlog that causes? Or are you focused on measures that will mean that these types of trials can start as soon as possible?
Well, we're trying to look at different options and build a consensus. You know, nobody, certainly not me, wants to be in a position where we're, you know, having trials without juries if we can find a better way of dealing with a unique and unprecedented situation. So, you know, I said at the outset of this epidemic, and again, it puts it into a category quite unlike anything we've dealt with before. None of us have dealt with a situation like this before. I certainly haven't. And we're trying to make the best judgments and do the right thing and do it in good faith. We'll all make mistakes and we'll all do things that we think are right, and then we'll listen to others and say, actually, maybe that's not the best way. That's what we did with the jury trial proposal, and I think that's right, to listen to voices across Parliament and to professional voices. So Mike Russell said that we would go away and look again at this and try to come to a consensus. We have a problem in that if we can't impanel juries, then we will have a significant backlog of cases. So is there a different way? And Mike Russell's taken forward these discussions, and when we've come to a conclusion on that, we'll set out what it is. Mark McLaughlin from The Times.
Well, Harry Burns was on Radio 4 this morning saying that the lockdown must be lifted as urgently as medically possible because we could be storing up lots of health problems for the future. Is there a tipping point between where the lockdown saves so many lives up front but potentially risks lots of lives and morbidities in the future?
Look, these things, Mark, are always going to be a balance, and a horrendously difficult balance given the circumstances we're dealing with. I didn't hear Harry. I'll make a point of listening to him because everybody knows how much respect I've got for Harry. I said I've never dealt with a situation like this before. That's true, but I was Health Secretary when we had the swine flu pandemic, and at that point it was Harry standing in Catherine's place as the Chief Medical Officer. So he's somebody I've got huge respect for and have worked closely with in the past. all of us want these lockdown measures to be lifted as quickly as possible, because nothing is without consequence. So of course we are doing certain things to combat this virus, but whether it's economically or socially or in health terms, what we are doing to combat the virus will have other consequences. And these are the difficult balances that we will continue to have to strike as carefully as possible. And these are the kind of judgments that we're having to make now and we'll have to make in the future. But I come back to a point I made earlier. Nobody is going to thank any of us. However much people right now think, I just wish we could get out of this, and would be delighted to hear us stand here and say, okay, it all ends in a week's time. A few weeks from now or a few months from now, if we do that, nobody is going to thank us when this virus has taken the kind of toll that we're trying to avoid it taking. So we will continue to try to take all of these factors into account and come to the right judgments overall. Simon Johnson from The Telegraph.
Good afternoon, First Minister. You were on the radio this morning basically indicating that the lockdown measures could be in place for some time yet, and stating that it was likely that a phased approach would be taken to lifting them, with some restrictions being lifted and others being left in place. In light of that, I'd be grateful for your view and that of the Chief Medical Officer over whether it is likely that people will be able to jet off on summer holidays this year, given that being in a compressed cabin with 200 or 300 other people probably wouldn't be the most conducive place for people to be in terms of stopping the spread of this virus.
Look, given that you listened to me on the radio this morning, and thank you for that, you will have heard what I actually said in response to these questions, which was, I don't want to be speculating without the informed basis on which to be doing it. So I said, of course it's possible we may end up in a phased lifting, but said I couldn't say that for certain right now, nor could I say which measures might be lifted in what order. And I'm going to be continually clear about this. I will share as much information as I've got, but I'm not going to be pushed into giving opinions about things when I don't have the basis to do it, because that is not treating the public with the respect that I think we have to treat them at this difficult, at all times, but particularly at this difficult time. I'm going to hand over to the Chief Medical Officer, but what I would say is I don't think anybody should be under any great expectation that summer holidays will be happening as normal this summer. I wish I could say otherwise, but right now I don't think that would be a safe assumption for anybody to make.
Catherine. Thank you. We have more information as each day and each week goes past. We have shared what we know and said what we've said today about the need for more real data using the real cases that we have in Scotland and in the rest of the UK. It will become more clear, and we will lift measures as soon as we can safely. But what we are already seeing in some countries across the world is that when measures are lifted, the cases jump up almost immediately, and the worry is, the concern is, that those cases will then be a larger peak than the first one. So there's a lot to learn from what's happening to countries where the virus has been there for longer. But at the moment, the key is to watch our own data and to listen to the scientific advice. We're watching, as I said, the other countries around the world. So I would not be thinking that those summer holidays are likely to be as they were in the past, but we really don't know. As soon as we have more information, as soon as we can lift these measures safely, we will do so.
Okay, Scott McNabb from The Scotsman. Are you with us, Scott?
Sorry, yeah, I was just on testing, First Minister, and the ambition to go beyond the 3,500 to the equivalence of the 100,000 UK figure, because I believe much of that would be antibody testing. And Matt Hancock's been saying that at the moment these basically don't work, that they're not reliable. So I'm just wondering if that ties with your experience in procuring these tests, and whether that would jeopardise the ambition to reach that higher target by the end of April, as he seems to want.
So it is not clear to me, and I don't mean this as a criticism, it's just genuinely not clear to me whether Matt Hancock's 100,000 figure includes antibody testing or not. We all have an ambition to see antibody testing, but you would have to ask him whether his 100,000 includes that. I would be surprised if it does, because as we've been talking about, we hope there'll be an antibody test validated soon, but we don't know that. So to rest a target for the end of this month on that becoming available wouldn't seem to me to be a particularly solid thing to do, but I don't know that. What I am talking about in terms of our 3,500 by the end of the month, the equivalent of the UK government's 25,000 by the end of the month, and then building diagnostic testing beyond that. I'm talking about diagnostic testing, and antibody testing, when and if that comes, will be a different part of our testing strategy. I really hope it comes soon, and I hope we have enough information then to have certainty, or as much certainty as you can get in these things, that it will be a useful test to help us get out of the coronavirus challenge. But we don't know that yet, and so I don't think it would be safe, and I certainly wouldn't give numbers of targets for testing based on a test that isn't commercially available yet, because I don't think, and generally speaking, I want, when I'm giving numbers, I want those to be numbers like the 3,500 based on firm plans that I know we can deliver, as opposed to aspirational targets that might or might not be delivered. Chris Green from the Eye.
Hi, First Minister. Hopefully you can hear me properly today. There was some interesting Scottish Government advice issued yesterday, which said that everyone should consider taking vitamin D supplements. I just wonder, it might be a statement of the obvious, but I just wondered if you could explain why that's a good idea.
On this one, I probably should hand over to the doctor in the room before telling people what they should and shouldn't be taking.
The advice on vitamin D supplements is that everyone should take those for the time of darkness, if you like, or when the October to March, when we're not all having as much sunlight as in the summer months. We have particular risk groups in pregnant women and the elderly, but actually the advice has been for some time that vitamin D supplements are useful at that time of year. You need sunlight to get vitamins into your body, and in the times of the year when there's not as much sunlight, the vitamin doesn't get into your system as readily, hence the advice for supplements. I am not aware of something that was issued yesterday that's specific to this time of year, because we're now coming into the time of year where there's more sunshine as the clocks have gone forward, and I'm not aware of something that's specific to coronavirus, but maybe you'll tell me otherwise.
Okay, if that is the case, then forgive us trying to keep on track of absolutely everything. We'll come back to you and confirm that later. David Ball from the Herald.
Oh, hello.
Okay, we can see you.
No problem. In Glasgow and Edinburgh, homeless households have been sort of moved into safe accommodation, sort of like empty hotel rooms. Will local councils be given support by the government to make sure there can be permanent solutions when that hotel accommodation is no longer available, so they're not forced to go back into sort of B&Bs that are unsuitable?
Well, as you undoubtedly know, we had already been working with local authorities on the back of the homelessness and rough sleeping task force that made a number of recommendations, and we have been working with local authorities to build up the housing first approach to housing homeless people and rough sleepers, which is very much about moving people into settled accommodation and then putting the other support services around them. And local authorities like Glasgow in particular are advanced in moving in that direction. So yes, we would want to see that kind of approach continue, notwithstanding the coronavirus epidemic. And lastly, Christine Lavelle from The Sun.
Hi, First Minister. It's been reported today that a member of the elderly community in Tayside was pushed into signing a Do Not Resuscitate order as part of some kind of COVID-19 protocol. I just wondered, has new guidance been issued to GPs telling them to do this?
I'll hand over to the Chief Medical Officer who'll talk about the sort of realistic medicine anticipatory care. But let me say, nobody, not just in these circumstances, but in any circumstances, should be pushed into signing up to anything like that.
There's certainly not any protocol, national or otherwise, that would discuss pushing people into a Do Not Resuscitate signature. We have had a lot of conversations. In fact, started by members of the general public, but taken on board by colleagues in primary care and in the hospitals, about people making their own wishes known were they to become significantly unwell. This is not something that's directly related to COVID-19. These are conversations that we would want people to have with their families at any time. And in particular, it's welcomed because some members of the public say that having discussed it, they realise their relatives have their wishes. It's all laid out for people to hear, and that they're often then not in a situation where relatives are urging them to go into hospital to have more treatment than they would have wanted for themselves. Of course, if people are wanting everything done, that is absolutely the right thing, and those shared decision-making conversations are happening and have been happening for many, many years across Scotland. These discussions perhaps are becoming more pertinent if people are going to become significantly unwell, but this is absolutely not something that we are discussing in the light of COVID-19 and pushing people into decisions that they would otherwise not be comfortable with.
Okay, that concludes the range of questions that we had notified today. Can I thank the journalists for joining us, and again thank everybody who has tuned in to watch. We'll see you again soon.